Good morning. I want to welcome all the agents that are joining us today for our Aetna D-SNP training. And we have Dan Dombrowski from Aetna on the line and Angelique Hughes as well. My name is Yvonne Blanco. I am one of the broker managers here at IAD. And if you have any additional questions, after the presentation, please reach out to either one of us. Our contacts will come up on the screen. You can always go ahead and click on chat or raise your hand if you do have questions during the presentation. But again, thank you so much for joining us and learning a little bit more about Aetna and the D-SNP. So with that, Dan, if you want to share screens, then we could go ahead and get started.
Hey, sounds great. Thank you, Yvonne, for that introduction. And yeah, I will go ahead and share my screen. So hopefully, as I'm bringing this up, everyone can see my screen. Can you see it okay?
I can see it.
Oh, okay, very good. Well, again, thank you, everyone, for joining today. And this is Dan Dombrowski, broker manager for Aetna for the southern half of Michigan. And today we're going to talk about our brand new D-SNP product that we're very excited about. It is a very great competitive D-SNP plan. So, just a quick agenda. We're going to go through some of the product features and then talk about why sell Aetna D-SNP, because there are a lot of great D-SNP plans in the market. So our goal today, one of the goals, is to show you where we are unique and different and how we can deliver value to you and your clients. So with that said, I'm going to talk a little bit about the network to start and the opportunity. The network is a definite advantage because this D-SNP plan does utilize the same identical network as our Medicare Advantage HMO and PPO plans, which means we have 90% approximately of the doctors in the state of Michigan that are contracted in network on our D-SNP. And to take it a step further, we do also have a nationwide network. So anyone that does sign up can access in-network doctors and hospitals across the country. And this plan also has no referrals required. Our D-SNP plan for this year, since it's brand new, we started out with 3 counties in the service area: Oakland, Macomb, and Wayne. And there are over 120,000 eligible D-SNP members that live just in those 3 counties alone. So a tremendous amount of opportunity. If you are working this market, you'll know what I mean. And it is a year-round selling opportunity. So it is a great way for you to earn extra income as we go through the year outside of open enrollment. So eligibility, these plans, as you all know, are for folks who do qualify for both Medicare and Medicaid. So anyone who's available or eligible for the Medicaid financial assistance, through the Medicare buy-in or Medicare savings plan. One really cool thing we do have here at Aetna is a hotline, which I'll show you on the next slide. But we do accept 4 different levels of D-SNP eligibility, of Medicaid eligibility, which is full benefit dual eligibles, Quimby only, Quimby plus, and the SlimB plus. So those are the 4 levels. And you'll see here in this chart, if the beneficiary receives full Medicare benefits, and then what the member would pay for their Part A premium and their Part B premium. And then also the cost sharing, what Medicaid would pay for the Part A and B cost sharing. And as you'll see in each situation across the board, Medicaid does pay the cost sharing for these 4 categories. So, in the next slide, I want to show everyone the eligibility hotline. So this is a really simple and easy tool that you can use. As long as you have the member's Medicare ID number, their last name and date of birth, you can simply call the hotline, which is 866-714-9301, option number 7. And they will not only give you the Medicaid level, so you'll know if they fall into one of these 4 categories and are eligible for Aetna's D-SNP. They're also going to tell you their LIS level, which is also known as extra help. So that will help you with determining what they may potentially pay for any prescription drug co-pays for the level of LIS that they do qualify for. So That is also important to know. And then we are also going to talk through just some of the embedded benefits. But before that, I want to just highlight the plan summary here, which is going to show you, a $0 monthly premium, 0 PCP specialist, and 0 outpatient hospital and medical deductible. So it's really just a 0 down the line for the members' cost sharing. And then you'll see some of the embedded benefits such as dental, eyewear, over-the-counter, transportation, hearing. We have a meal programs that we're going to get in a little detail on those. So we'll cover those here in the next couple of slides. So to talk through some of the embedded benefits and to really show you, I think, where Aetna delivers the most value to you and your clients, we have a fall prevention benefit, which is a $150 allowance. This is very nice because we will install safety devices and equipment for anyone who has some challenges with impairments or mobility. We are the only carrier that actually has this benefit, so that's really cool. The transportation is 24 visits, 24 trips. Those are all one-way trips up to 60 miles each direction, and it is a $0 copay. So things such as prescription drug pickup or doctor visits. So a nice transportation benefit with up to 60 miles. Hearing is at $750 per ear, so that's a $1,500 benefit each year, and of course includes the hearing exams with a 0 cost to the member. Then we have the eyewear allowance, which is $250, and this is for any eyewear such as lenses or frames or contacts. And as long as your client were to go to a iMed provider, they do not have to have any money up front because this is an allowance. So typically with the allowances, they have to pay up front and get reimbursed. But in this case, iMed providers, their reimbursement is taken off at the point of sale. So as they're checking out, they would the total would be subtracted by $250. So as long as their eyewear is under that, they would pay 0 out of pocket. We have a personal emergency response system, which provides 24/7 access for emergency level care with a 0 cost to the member. And then our over-the-counter benefit, which is the highest in the state for all D-SNP plans, $360 per quarter, which is tremendous. This is through CVS, and this is over $1,300 per year just in OTC items. So a very, very rich benefit on the over-the-counter. The meal program is 42 meals if a member is hospitalized. Upon discharge, they're eligible for the meal program. And then we have the PAPA benefit, and only a couple of the D-SNP plans have this. We're really happy that it's there because this is really, a lot of folks do enjoy this program, 10 hours a month. This is your family on demand, things that you'll see on the page here, conversations, board games, things like prescription drug pickup, some light meal preparation, some light cleaning, and that kind of stuff. So this is a nice benefit to have. And again, not all the D-SNP plans have the PAPA program. So model of care team, which we find to be a big advantage to not only the member, but the agent, because as you know, as an agent, one of your primary focuses is on selling new business, but it's also on retaining your existing clients. And this is a way that we can help you retain your clients through our model of care, because we do such a tremendous job engaging the clients that sign up. D-SNP members have a quarterly enrollment SEP, so they tend to have a little bit higher, cancellation rate, if you will. But this is a way that we can help them to engage, to take a more proactive approach with their health, and then with their health, And Angelique is going to talk a little bit about that in detail here momentarily. So Silver Sneakers is a $0 copay, and that's also included in the plan. And then lastly, embedded, I left the dental for the end, because this is probably, from what we hear from our agents, they tell us the dental is a very competitive. It's probably one of the key selling features. Some of the D-SNP plans out there have exclusions on their dental, things like dentures and implants and crowns. But the Aetna dental plan, what we did when we designed this is we said we do not want to exclude benefits, some benefits that the community might need the most. So what we've done is said we're going to include all dental services. The only exclusion is for teeth whitening because it is not deemed as medically necessary by CMS. But other than that, this includes all comprehensive and preventative dental services at 100% in network with zero cost to the member. It does use the Aetna Dental PPO network. And this other nice thing is this can be used on day one of the plan. So the moment they sign up, they can use their dental benefit. We're not going to put waiting periods, and we're not going to space this out throughout the year. So that is another major advantage of the dental. Now, a couple examples here. As I said, the only exclusion is teeth whitening. So everything from crowns, bridges, dentures, and implants, oral surgery, restorative, extractions, really all of the other services that someone would go in for their dental needs is covered with 100% cost sharing, zero cost to the member. Okay, so at this point, I want to show everyone on the prescription drug side of the benefit, the levels of LIS. So as I said from the start, when you are verifying the D-SNP eligibility, not only are you going to be able to obtain the Medicaid level, but the LIS level is important because this will, in fact, determine what they could potentially pay for their prescriptions, whether it be generic or brand. So you'll see here, if they're LIS level 3, they're essentially paying zero across the board. However, folks that fall into category 1 and 2 could have co-pays for their drugs, depending on if it's a generic or a brand. And then of course, LIS level 4 does have a bit higher out-of-pocket cost to the member, being that it can be 15% of co-insurance plus the $92 deductible. So we have seen some situations, and I want to remind everybody that due to COVID, there's been some delays, obviously across all facets of life. All of us have experienced here, whether it be the mail system or processing of paperwork. We have seen Social Security Administration with some delays, CMS as well. So if there is not an LIS level assigned to the member, that would be treated as if there was no LIS. So they could have cost sharing. So it's important that you help these clients with making sure that they have the LIS level appropriately on file with Social Security and CMS, so that way their out-of-pocket cost sharing is lower in what it should be in terms of what they're entitled to. So I just wanted to mention that because we have seen a couple cases like that come through, and we wanted to just make that clear for everyone. So okay, so at this point we are going to touch base on provider billing for services and how that works. And at this point, I'm going to hand it over to Angelique Hughes, and Angelique is our business manager for the D-SNP product, and has done a great job with helping to grow this product. So we work as a team here. And Angelique, I will hand the ball over to you, and you can take it from there.
Thank you, Dan. And Dan, actually, if you don't mind continuing to show your screen as I speak, I think that might help things just go a little faster, if that's okay with you.
Yeah, absolutely.
Okay, thanks so much. Thank you, Dan, and thank you everyone for joining today. And I just want to piggyback to what Dan was saying regarding the LIS, the low income subsidy aspect. As he mentioned, we have seen some situations where individuals who are newly enrolled in our plan, they have our D-SNP, yet the Social Security Administration, even a month in, has not assigned a level of low income subsidy to them, whether that's a level 1, 2, 3, or 4. So the way to kind of get ahead of the curve for that, as Dan mentioned, is when you're enrolling the member, if you contact our broker services department, you can ask that person, as Dan mentioned, what level of low income subsidy they see in the system for the member. And if they don't see any level, that could be a good trigger that the member may not be enrolled in the LIST program yet. A lot of times you may see this as someone has just turned 65 and aged into Medicare, so they would be newly eligible for the D-SNP plan. So what we recommend is if the broker service department says they don't see any level of LIST, that you could assist your client by actually calling the Social Security Administration with your client on the phone and asking to enroll them in the Extra Help program. I've done that with a couple of individuals who are already enrolled in the D-SNP, and the process was really seamless. They do require that the member or your client be on the phone, and typically when you call, they will have someone call that client back within 15 minutes and they'll complete the application over the phone with the client. But if you could help them facilitate that enrollment, that would be very helpful. So otherwise, the other option is if you don't do that before the enrollment is completed, once the client is in the D-SNP with us, it's just a slower process, us having to really start the wheel once they're already in the plan. Any questions regarding that process before we move on? Okay, so Dan showed you the benefits that we offer. So of course, after members go and start receiving our benefits, there's going to be billing involved. And I've received some good feedback from brokers. And one of the things that was mentioned is if we could start just talking about really high level, what brokers should know just in case their clients call them and say, hey, I got this bill, what do I do? So that's why we wanted to take time and just talk about really high level provider billing for the D-SNP plan. So first of all of the providers who are in Aetna's Medicare Advantage network are also in our D-SNP network. We have notified our providers of that. We've sent letters out. There's online information for them to know that. However, there's typically some fallout where all providers don't receive that notification. So sometimes they will tell their members, we don't accept D-SNP. Well, they have to, because D-SNP is a Medicare Advantage plan. So just so you know, that's one thing, that if the providers say they don't accept D-SNP, if they're Aetna Medicare Advantage provider, they actually have to. And Dan, if you don't mind going one screen back. I was just doing a lot of ad-libbing, so didn't get to talk about this yet. So just so you are aware, anyone who's eligible for our D-SNP, whether they're a Quimby Plus, a SlimB Plus, or a full benefit dual eligible, they're considered cost share protected, which means they legally cannot be billed. In fact, it's a federal regulation that anyone who's a Quimby or Quimby Plus, that providers cannot bill them, or they can actually be sanctioned by the federal government. So it's not a matter of a provider saying, I don't accept Aetna, even though they're a Quimby, legally they cannot bill the member. Next slide, please. So some key points to consider. So once the provider sees the patient and they bill, federal rules dictate that Medicaid is the payer of last resort. So with our D-SNP, that would mean Medicare has to pay first. And then if there's a portion of the bill that's left over, then the provider needs to bill Medicaid if it wants to seek payment. So since our D-SNP is a Medicare Advantage plan, we are essentially paying in Medicare's place, which means the provider will first submit the claim to Aetna. Once that happens, we will issue an explanation of payment or an EOP statement, and it lets the provider know how payment was broken down and if there's any remaining portion that we have not paid. At that point, for that remaining portion, the provider can then submit the claim to Medicaid, or if the patient is receiving their Medicaid through a managed care organization, they could submit that claim to that patient's Medicaid health plan. Now, providers who want to submit a claim to Medicaid have to be enrolled in the state of Michigan's Community Health Automated Medicaid payment system. If you can go to the next screen, please. So that system that I just mentioned is also referred to as CHAMPS, and that's the system where providers will submit claims for payment. So if providers need help enrolling, if they're not already enrolled to have access to CHAMPS, here's a toll-free number through the state of Michigan where someone can help them over their phone get set up so that they could start receiving Medicaid payments. Next screen. Next, I want to talk about characteristics of the dual eligible population. Some of you may already be familiar with D-SNP clientele, some of you may not. So just really nitty gritty, who is dual eligible? It essentially means the person is eligible for both Medicare and Medicaid at the same time. And essentially, if they qualify for our D-SNP, Medicaid is paying for that person's Medicare Part A and B premiums, or they could, and they're also paying, Medicaid is also paying for that person's Medicare deductibles, co-insurances, co-pays. So that leaves the member with having to pay zero out of pocket for those Medicare medical services. Next slide, please. So I wanted to highlight here just some education and income differences with the dual population in Michigan versus individuals who have Medicare, but they don't have that Medicaid assistance as well. So if we look in this column where it says full duals, under education, for example, where it says no high school, 44.6% of individuals who are full duals. So again, a full dual, referring to that chart that Dan showed several slides back, means a person who not only is getting Medicaid's help to pay for their Medicare premiums and their Medicare cost shares, but on top of that, they also receive full Medicaid benefits. That's considered a full dual. A partial dual, which you'll see in the column to the right of that, is an individual who's only receiving that help from Medicaid for their Medicare premiums and cost shares, so they do not also have access to full Medicaid benefits. And then in the last column where it says non-dual Medicare only, this is your traditional Medicare member. So a member like my parents, for example, who are above the age of 65, they've aged into Medicare, so they're both in Medicare Advantage plans, but they don't have that Medicaid component because there's not that financial need tied to it. So what this is really just showing are the differences between someone who might be a D-SNP member versus someone who's not. And we see that, for example, someone who's a full dual, in that population, 44.6% of them have no high school education. Compared to if we jump over to the last column, only 14.4% of individuals on a traditional Medicare or Medicare Advantage plan don't have any high school education. If we jump down to the some college line, we see that for full duals, only 25.5% have some college education, compared to if we look at the non-dual Medicare only, over half of that population has a college education. If we look at the income status, we see that when we're dealing with the dual eligible population, under the full duals, 55.6% live below the federal poverty level. Even when we're looking at partial duals, so individuals who get that Medicaid assistance for their Medicare premiums and cost shares, but not full Medicaid, the full suite of Medicaid benefits, even there, 37% live below the federal poverty level, compared to our non-dual population, where only 3% live below the federal poverty level. Next slide, please. This slide just talks about some age and ethnicity differences in duals versus your non-dual Medicare beneficiaries in Michigan. And I wanted to include this just so you get a better understanding of who your customer might be. So when we're looking at the full duals, we see that for age 65 and over in Michigan, 46.1% are over the age of 65. So that really goes against traditional Medicare when we look at the final column for the non-dual Medicare only, where individuals have to age into Medicare or be on disability to receive Medicare before the age of 65. So in that population, 88.6% of people are over the age of 65. So what's that telling you? That's just really giving you the expectation or anticipation that if you're looking for clients to service, it will be, for example, individuals in senior centers and that, but not only. It could be individuals really anywhere from the age of 19 all the way up to over 100 who could be eligible for the D-SNP. For age under 65, we see that over half in Michigan, 53.9% are actually under the age of 65. When we look at the sex category, over half in Michigan will be female, 60.6% compared to 39.4% male. And then we look at race and ethnicity, and I put this just to highlight some opportunities again about the population that you can serve. So we see that 65.5% of full duals in Michigan are classified as white, not Hispanic. Well, when we look at this a little deeper, if we're looking at roughly 120,000 dual eligibles, as Dan mentioned earlier, who in Michigan, looking numbers wise, we're looking at over 70,000 individuals who fall into the category of white or not Hispanic. But Southeast Michigan is unique because we're home to the highest concentration of Arab Americans in the United States. So what does that mean? According to the US Census, Arab Americans can classify as being white. So as you're looking for prospects, I would just encourage you to just consider that it's not just your typical white American, but Arab Americans, Chaldean Americans as well fall into this category of the over 70,000 in the pool of people who would qualify. So that means that there may be some language barriers or language opportunities for you. So if you speak Arabic, if you speak Chaldean, if you know other brokers who may, this would be an opportunity to cater to that population. When we look at African American, when we see 26.4%, that's roughly 35,000 people. Hispanic, we're at 2.5%, which is roughly 2,700 people. When we look at Asian Pacific Islander at 3.3%, that's roughly 3,500 people. In a recent conversation that I had with a leader in Southeast Michigan's Asian American community, who is also a professor at Eastern Michigan University, and she works closely with Medicaid beneficiaries. She said that particularly with the Japanese American community here in Southeast Michigan, there's a great need. So with those who qualify for Medicaid, they fall into two buckets generally. One is the bucket where they have health insurance, but due to language barriers, they don't know what it is and they don't understand how to use it. And then the other bucket is they need the insurance, but they don't have it because of the language barrier, they don't know how to get it. So again, here's another opportunity. If you speak Japanese, if you speak Chinese, if you speak Tagalog, for all the various Asian American communities here in Southeast Michigan who would qualify, the opportunity is definitely there. Next slide, please. So next I want to talk about the D-SNP model of care. Every dual or every special needs plan that wants to operate has to create what's known as a model of care document, and they submit that to the Centers for Medicare and Medicaid Services for review and approval. And what that model of care does is it documents the population and the area where the health plan wants to operate. It gives some of those demographics such as what I just shared with you about income, ethnicity, education, but it also talks about how the health plan will deliver care to help ensure that the people that they're serving are having a better quality of life as far as their health care is concerned. And it talks about who in the health plan will be available to serve those members. Because the Centers for Medicare Medicaid Services, they never want to see any of their beneficiaries harmed. They want to see that these plans are going to do good and help the most vulnerable population. So we pride ourselves at Aetna. We're very thankful that we have, which our model of care details, we have a care management team. So every member who is enrolled in our D-SNP, they have like VIP treatment available. So that team consists of a registered nurse, a licensed clinician, a care coordinator, and then also an interdisciplinary care team. And each of the roles in here act differently to assist the member. So for example, if we look on the left side of the screen here, it's showing that our members receive coordination of Medicare, Medicaid benefits, services, and providers. So our care coordinators are there to help coordinate the members' benefits for them. We have social workers who are part of that team as well. So if members need additional resources, the social worker will look in the community and see what resources may be available. One member, for example, recently called to see if wheelchair ramps were available. So the social worker was looking to see what community resources might be available to provide wheelchair ramps. Also, as the second check mark here shows that members receive comprehensive health risk assessments. One of the Center for Medicare and Medicaid Services requirements is that within 90 days of enrolling in a special needs plan, a member has to complete a health risk assessment. And that's the member working with the health plan just to really self-identify and talk about how they believe their health is in areas where they want to improve. So we have a team of health survey specialists who are dedicated to completing that health risk assessment for our members. And it's really critical that they get that done because that's how we're able to develop an individualized and personalized care plan, which is really just a game plan where we work directly with that member to enhance the areas where they want to see improvements in their health. We work together with them. Transitional care if discharged from the hospital. As soon as our members are released from the hospital, our care team is notified. So they reach out to the members. They make sure they understand their discharge instructions. They talk about any upcoming doctor's visits that they'll need. Some of our all of our members are eligible for, if they're after an inpatient hospital stay, they're eligible for receiving 21 meals 2 times a day, so 42 meals. So our care team can help coordinate to make sure that they get those meals as soon as they need them as well. And part of our interdisciplinary care team, I'm jumping down to the last role that you see on the right hand of the screen. That also includes the member's provider. We really encourage the primary care physician to play a key role on this care management strategy because we really work hand in hand with the providers. And we really know the providers are really that first point of contact so they can communicate with us. And the interdisciplinary team has ongoing reviews and meetings for each of our members. And we want the doctors to be a part of that to really help give the members the best that we can give them. Next slide, please. Okay, plan guides and enrollments. I'll pass it back to you, Dan. Thank you.
All right. Hey, thank you. So yeah, at this point, I'm going to touch base on Producer World. So this is the agent portal where you can access all of the information necessary to you to market and sell the D-SNP product. So it could be, plan guides, enrollment materials, things like commission statements. So Producer World is your one-stop shop, and that is accessed through Aetna.com/agents and brokers. And I'm going to talk about an enhancement to the Ascend platform, which is our online enrollment tool. And the enhancement is the value-based enrollment, which at the very end of the online enrollment in Ascend, even after you get your confirmation number, once the application has been submitted, you can click a box for agent complete health risk assessment. So we have this built in, and you get a $70 per application admin fee by simply doing about a 5 to 7 minute health questionnaire. There's questions such as, have you been to the doctor in the past 12 months? Things like that. So, definitely a good way to earn some extra cash and, help your clients get a head start on their model of care team with Aetna. So that is in the remote enrollment tool. I want to mention as well, if you need any refreshers or training on Ascend, the enrollment tool, we do offer those on our landing page, which is our training website. And that is Aetna Medicare Agent Training.com. So once again, Aetna Medicare Agent Training.com, and you can sign up for an Ascend training. And we will be doing those overviews. I believe we've got them out there about once a week. So stay tuned for that. So once again, with the value-based enrollment, if you click on Agent Complete and ask the health questions, it is a $70 admin fee per application. Then the other option is scheduling a call. So we would have a wellness advocate from Aetna do this. And if the call is scheduled, then you don't have to take part, but you still do get a $10 admin fee for that. The other option is decline. This is completely optional, and it just helps us to gather some data so we can be more proactive on helping these folks manage their healthcare needs. Okay, so from here, for as far as selling the product or more information, the next steps, the two main components to sell and be ready to sell is certification and contracting. Certification does have two parts, which is AHIP and the Aetna Core Product Certification Online. That is the website for our certification that you see in step number 1. And then market training is also a requirement. And the market training can be accessed through our training website. And that is, again, Aetna Medicare Agent Training.com. And once you've done that, you will receive a ready to sell notification. If you're not yet ready to sell, or if you're just not sure, let myself know or Yvonne, and we can certainly check that for you. Okay, and I wanted to point out as well, we do pay CMS maximum allowable commissions for not only Advantage, but D-SNP. It did go up this year to $539 for new members. Renewals are at $270, and those are lifetime renewals. So that is a nice benefit. And this was a 6% increase from last year. Value-based enrollments, again, adding that on, and I got to update this because we did bump that up from $50 to $70. It is $70 per application for simply completing the health risk assessment. Okay, so for your first line of broker support, we are fortunate in Michigan to have Lynn Peterman, who is our dedicated Medicare account associate. She is an extension of broker services, and she can help with things like ready to sell status, anything dealing with contracting, commissions, or licensing and appointment, things for onboarding, member ID cards, application status, anything you see listed on the screen. And I wanted to provide Lynn's information. Of course, my information is also listed. And then our broker support team, and they're available 8 a.m. to 8 p.m. Monday through Friday. So that is your broker support for Michigan. And this is for not only the D-SNP, but the Medicare Advantage as well. Okay, so at this point, we're going to just pause, and then hopefully through the product features and the model of care, portion, we were able to help uncover some advantages of the Aetna D-SNP product. We have a very solid plan. It's very competitive from a standpoint of dental. Once again, $2,500 in dental. All dental services are, except for teeth whitening, are included in that dental benefit. We have the highest over-the-counter allowance. We have the transportation. The network is identical to the Advantage Plan network. Again, 90% of all doctors in the state are contracted in the network. There are some D-SNP plans that have some networks with some holes in them. So this is a great way for you to get clients into a plan with some freedom and flexibility here from a network perspective. So, our hope today was that we were able to uncover some of those advantages and the value points that we can deliver to your clients as well as yourself. So with that said, I just want to thank everyone first, Yvonne as well, for setting this up with your agents and, for the opportunity. So thank you for the opportunity to earn your business. We would love to partner with you. Let us know what you need to sell and what questions that you have that we can help clarify or answer for you. So at this point, I'm going to open it up for any questions that might be out there in the audience, or Yvonne, if you have some questions or things that you want, clarified, happy to do that at this point. And we can, take a moment to do that.
Yeah, so I do have a couple questions that came in. So let's see. Are you still sharing?
Yeah, I did take the presentation down, but you should see the last slide.
Okay, super. All right. So one of the questions that came in, and I just absolutely love how you guys highlighted, especially the cost sharing portion. There's a lot of brokers that don't understand how Michigan and the balance build and the cost sharing, how that all works out with the billing. So I guess one of the questions were like, what steps are there, or can you give us steps if a member has been billed? Do they go through the carrier or do they go through the provider?
Yeah, so if you do have a member that does get a bill, probably the best thing to do is to, let us, you can go through the provider, but we can also research that for you. And if we have the member name, the member ID number, a little bit of a description of the issue, and maybe any screenshots or bills that you can attach, we can actually get that logged into a system, which we can actually put into a queue that gets escalated to the member service department. We have a team member of senior level member service coordinators that can kind of research that, take ownership of that, and help us to get resolution on that. So we would encourage you to let us know about those situations so that way we can help find resolution on those as they come up.
Perfect. And then thank you for that. And then the next one is on the PERS, on the Personal Emergency Response System. When a broker does sign up a member and they're interested in that, are there instructions in the kit? How does a broker acquire how to help their members to sign up for that PERS?
Yeah, no, that's a great question. And I will answer part of that. And then Angelique, if you want to chime in as well, feel free. But, so my understanding is that when everyone signs up, they will get information in the mail of the benefits available to them with how to utilize those benefits. Again, Personal Emergency Response System being one of those great benefits. How to connect with those folks in the event of emergency. So another thing they can always do is call the number on the back of their ID card. If it's Aetna, now certainly if it's an emergency, you're not going to be calling Aetna for that type of situation. So we also do have our core, model of care team and our care coordinators, that can help the members navigate the benefits that are available to them as part of this plan, to make sure they fully understand them, to make sure that they're taking advantage of all of the necessary benefits, and to help explain anything that might be, in question. So, I just wanted to provide that. But yeah, Angelique, if you want to add anything to that, I'm not sure if you do, but that's kind of what I would say regarding that benefit.
Yeah, I think it's an important benefit. I love that. Did you have anything else, Angelique, that you wanted to add on that?
Yes, I'm sorry. I was trying to get off of mute. So our members, once they're enrolled in the plan, they're able to call Life Station. That's who administers the benefit. They can call them directly to obtain the benefit. And what LifeStation will do is perform, just give a little survey to determine if the member needs fall detection benefits, in addition to which system would best suit their style, because there's different options that are available to the member. So once that survey is completed, LifeStation will then ship the equipment directly to the member to be installed. And again, the program is free of service.
That's wonderful. And I do have, sometimes I give suggestions to the brokers just so they can go ahead and do that HRA. Sometimes the member doesn't want, they're done, they did their application, they've kind of put it in their mind that they're finished. I will let the brokers know, go over that OTC benefit with them, go over the allowance, go over the PERS, see if you can set them up as you're doing that HRA, because I think that is important for them to get that, done for you guys. So other than that, thank you everybody for joining. And I want to thank Angelique and Dan again. I think I think you're sharing screen still, so there's a delay, but I want to thank everybody and have a good rest of your day.